Hi, this is Mike Uretz. I'm the executive editor of dentalsoftwareadvisor.com and also the EHR editor for Dental Products Report.
Dayna Johnson and with Ray Dental Management, and I help dental practices and dental teams transition from paper charts to a paperless environment.
Dana and I did a podcast though a while back, and Dana does a lot of implementation and training for practices, and it was very interesting. We discussed a lot of the challenges and pitfalls with doing implementation. So I guess, Dana, going back to that, can you talk a little bit when you go into a practice, right? First of all, how do you get buy-off on actually doing a real implementation and not just flying by the seat of their pants?
Yeah, that's a good one. Definitely, offices will reach out to me if they're ready to transition to a paperless environment, or they've gotten about halfway and now they're stuck. And it's like, okay, now can you help us, get all the way to the finish line? And so usually the first thing I want to do is do an assessment, see how far they've gotten, talk to the team, find out what pieces that they're struggling with. And because I don't come in with a cookie cutter type of program, it's really their systems that we want to put into place. And so it's usually a pretty easy buy-in because I'm addressing all of their issues and making sure that we put systems in place to fulfill their goals, and it's not just a consultant coming in and saying you're going to do it this way, because there's so much room for flexibility.
Right. Let me ask you this: when they don't have a person like you, what kind of mistakes do people make when they try to do this themselves and not having ever gone through an implementation? What are some of the challenges?
So the challenges are when they don't know what the rules are, the legalities. And so, with a paper chart, we used to just write everything down and we could cross things out, and there was that paper trail. But when you do an electronic record, if you delete something, it's gone forever. And knowing what the HIPAA requirements are, the payment card industry requirements are, what can they put on their schedule in the computer, where do they make notes in their computer software, what's secure, what's not secure, those are the things that they kind of forget about. And they just want to start documenting in the computer, and they forget about HIPAA security and signing things electronically and locking things up for legalities. And so those are the kinds of things that they forget about.
I'm going to push
and backup. Oh my gosh, I can't forget about backup,
right.
Because now it's, you have this paper chart that you put up in your cabinet, but when you're on a computer, a paperless environment, everything is in that computer. And so backup is also a huge pitfall that we have to get over.
I'm going to put you on the spot a little bit.
Okay.
And as they say, it takes two to tango. In my experience with implementations, there's a clinical side and the practice management administrative side. Do you usually find that one side comes up short? Because my experience, I'm not going to mention one,
yeah.
but sometimes one group or another, a lot of groups will do their job and others won't. Can you talk about kind of dynamics of the different groups having to share with the implementation?
What I find is not necessarily different dynamics between the groups. However, the clinical team typically struggles a little bit more than the admin team. The admin team, they're on the computers all the time. That's what they grow up with. And they're using computers for scheduling and billing way before they go paperless. So the clinical team typically struggles a little bit more. And in my experience, it's usually the hygienist. Because the hygienist is kind of, they want to treat their patients clinically, and so for them to have to put information into the computer can sometimes be a big struggle. And so just finding out what their pain points are, finding out, okay, what slows you down? Is it typing? Is it, the health history update? Find out what's slowing them down, and then come up with a way to overcome that.
I guess one of the questions I have, I talked a little bit before about people that try to fly themselves and not doing this.
Yeah.
As a consultant, when you come in, can you give some advice on actually how practice, not just you personally, but a third party like yourself, how they can use you to take advantage of your skills in an implementation? How could they take advantage of that?
Right. So I think because I've not only worked in the dental practice for over 20 years, so I know the dynamics of the team, but also I've worked with hundreds of offices in their office as an outsider coming in. I've seen lots of things that work and lots of things that don't work. And so I'm able to come in and say, hey, have you tried it this way? Or this might work really well for your office. And so I can come in not only with a dental team member perspective, but also as an outsider perspective.
Well, I guess I hope that if folks are interested in what we're talking about, they definitely take time to listen to our podcast because it's a lot longer, a lot more in depth. And I appreciate your time again.
Thank you, Mike. It was great talking with you.